Thanks for staying with us. So this issue of brain drain is still on the front burner, especially because recently the NME had a conference where it was revealed again that we have over 300,000 deficit of doctors in our country. Aside from that, YK also read a human interest story in Punch about a woman who died at Medville Hospital in Lagos State. Her husband probably brought her from Anambra thinking that you get better medical treatment in Lagos State. Unfortunately, she passed on. Not only that, they were demanding payment before the baby could be released to go and get also additional care at a teaching hospital. Now, these kind of stories aggravate the average Nigerian because you think that health should be paramount to not just the government, but to people and the private owners of these businesses. What are your thoughts on this issue of brain drain, people's inability to understand how important or to even provide the optimal health for patients, regardless of issues of money or not? What are your thoughts? How do we reconcile this in our country? Should we all run away from medical treatments? I was on a call yesterday, 2 days ago, with somebody who said, Mariah, if I have a headache, I'm on the next flight out of here. I can't let the Nigerians come and kill me. As ridiculous as it sounds, is the reality of many people, because if I have the means, maybe I'll be getting my Panadol in London. What are your thoughts on this? You can call us on 081-270-53687, 091-390-7694. You can also tweet us at TVC Connect. Please hashtag YourViewTVC so we can read your tweets. Listen, we boast of the best doctors in the world. I mean, everybody says, and I've shared this story before. Pastor Ita was saying that his wife was sick in London, and he was going helter-skelter. And he said, listen, this matter, there's only one doctor that can solve the problem. He had to want a very expensive neighborhood that he had to take his wife to. And he was waiting. They booked this doctor for days. He couldn't even, almost a few weeks before he could get an appointment to the doctor. He finally saw their doctor that they've all been waiting for. So one small Janjala boy just came like this. And was like two tall guys behind him. Like, who is this guy that I'm waiting for? Finally, when the guy started looking at like his wife, and he just said, wait, sorry, what's your name? He said, Emeka. I said, really? You're Emeka? You're Nigerian? I said, yes, now. So and he was shocked that all these guys were running after this doctor because he was so hard to find. So we have the best doctors abroad. But we are losing them on the daily. They get their first degree here. They go there, do the 1 or 2 courses, and they become doctors.
Okay, so this sad story of the lady in the papers, we might not know the entirety of the intricacies of what happened, the medical condition, what maybe the hospital tried their best. But one of the things that was clear was that the man was trying to get help for his little baby. And was the life of that child, even though the life was threatened, was conditioned based on him paying the bills that were already on ground. That is not a society. That doesn't come from somebody that values human life, because this is a man that's already lost his wife. And now he might end up losing that child. And you're telling him until he pays the 500,000 bill, he cannot get the child to get proper health care. That already, for me, is something we should resolve in court. Because until we start having conviction of, sadly, this health care sector, they would understand the value, the cost, because they know what it will cost them if they get a conviction against them for mismanagement of the health of the people in their custody. Then, our president travels for medical checkup almost, I mean, is it every quarter or maybe twice a year, every quarter, right? So obviously, the president doesn't trust the health sector in Nigeria, and he's the president of Nigeria. So, like, what do you expect? If all the other politicians, their mentor is the president, and when they see the president is going abroad, they will go abroad. The average Nigerian too, when they see that they are sick and they can afford it, they will go abroad. Everybody is changing money for medical tourism, and our own doctors are looking at it that maybe they'll pay me better when they come and meet me abroad, right? Because doctors in Nigeria are not well paid, so they will go abroad. You will go and pay them what you should pay them here. You will pay them abroad. What are we doing? We are fooling ourselves.
I think the worst part is when the president goes abroad, who treats him? It's Nigerian doctors that will treat him.
Most likely.
So you are going abroad, you are seeing that it's your people that are there. Because I remember many years ago, my brother was on tour and he fell ill. So he had to be rushed to the hospital. He said, and it was in London, he said the whole hospital where he was, everybody was Nigerian.
Speaking PG.
The nurse, the clinic, they were all Nigerians. He said he was shocked that so many Nigerians in England. And it is just, you know, one thing I want to talk about is the mushroom hospitals in Nigeria. We should stop allowing mushroom hospitals to operate. I will give you instances. I know of at least 3 people who had babies in one of these hospitals who are not supposed to be mushroom. They are owned by, but, okay, the first one, when the doctor died, the hospital shut down. The hospital shut down. Yeah. She went back for records for her birth later on. She couldn't get anything because there was no hospital there.
Wow.
There was no hospital there. Another one, it was even my sister that had her baby near Kini. Every time I pass that place, it's an empty shell. There's nothing like hospital there. And I'm like, this girl, the child is about 6. The hospital is not there 6 years later.
Right.
I passed there.
So we find this, one of the problems I had also in this medical issue is that why don't these doctors, some Nigerian doctors, come together, get about 5-10 of you together and build something really, really formidable? Because I found that even when my mother was sick, you go to one to go and do radiology, you go to another to go and get results, you go to another to go and do different all over the place, except you go for a teaching hospital. Most of the hospitals, they're not fully equipped. You go to a regular hospital, they're all mushroom hospitals, so you're constantly waiting for, he comes on Thursday, or he comes, you're waiting for consultants. Why don't we all just come together and form one big hospital that has every single thing in it? A few of Nigerians have come together, and they're building hospitals, we've seen that, but it's not enough.
Remember we had, sorry.
Go ahead.
You remember we had one doctor, we were in the other studio before he was burnt. The reason, and I was when I called the doctor, when she came on set, she couldn't talk. I had listened to her. That's why I said they should invite her. If you hear the complaints from her or how to run a business here in Nigeria as a hospital, her frustration, you will know why they don't all come together. You will know why they spend diesel alone.
Exactly.
It's a cocoa.
Let's not even talk about
in
diesel.
Nigeria,
if we remove diesel.
By default, there are only 2 things that can worry you. Because malaria, typhoid, and maternity. So when you see all those mushroom hospital YKC, if you don't see maternity and clinical, you don't get, they don't call it a guide, they call it maternity home. Then there will be a scan lab just down the road. When those want to do scan there, they are dealing with women, but it's a man, and he will touch everything. And then he will come out and tell you, there was one in Festac. Oh my God, I cried that day. I'd not had a child before. I was going through fertility, and they said, go for a scan. And he just touched me. I don't know whether I put off the person, his last patient, whatever. I said, your tubes are blocked, your this are blocked, have you aborted before, and everything. I just went mad, and I was alone. Oh. And he just gave me that. No, initially they said, your referral, your HMO is not with us. And even though they had called them, it was just poor service from beginning to the end. I wanted to pay personally. They said their POS don't work. I said, can I do transfer? They said, madam, you have to get us cash. I then trekked to the nearest bank a few meters away, trekked back, and they just threw that report at me, and nothing happened. They did not even feel anything. So we need to find hospitals. When you go to a GP, you know what it is for. Please walk away when the person is talking to you general. You know your condition, find your condition, a doctor that specializes there. Until I found gynaes that I could talk to. I did not know. There was one that I went to, and I said, I missed my period. This is what I think I have. Then I didn't know it was PCOS. I said, madam, you want to do PT? Do a PT. Collect money. And they will pay. That one is on Odojo Road. I still see that hospital every day. And they just collected the money and said, you're not pregnant, so you cannot be pregnant. That's a doctor. And I was looking at him like this, myself and my husband. From then on, if you are talking to me and it's not from a place of knowledge, you don't understand my situation that I have read. Thank you very much. Close the hospital and go. So regulation of this practice has to be top-notch. Yeah. It has to be top-notch. Ministry of Health, please.
When we go on a break, when we come back, we'll open our phone lines. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we're going to open our phone lines, take a few messages. I have one from a big sister. She says, morning, Mo. Medical abroad is for the rich. Only if you are a citizen. Consultation is £200 minimum per session. Wanted to do blood tests with tumor mark. was given £950 as cost. Coesio. So, yes, medically, and I have a call from London. Good morning, Ayo. Are you there?
I'm here. Good morning,
You're
Mariah.
live. Go ahead, please.
I'm a first-time caller.
Welcome to I can hardly hear you.
Oh, okay. Can you hear me now?
Yes, go on.
Yes, maybe the studio guys can hear you. Me, I can't hear you.
Can you hear me now?
Oh, yes, I can hear you. Thank you very much.
Okay, all right. I mean, the story being shared today is very pathetic. I'm just going to share 2 quick experiences, and I will make my submission if that's okay.
Please.
3 years ago, my daughter had an asthmatic attack, and we called the hospital. Within 10 minutes, the ambulance arrived. They took her to the hospital. By the time we got to the hospital, there were 10 professionals waiting for her, waiting for the arrival. And before we knew it, less than 15 minutes, she was being taken care of. Everybody introduced themselves. She was taken care of, got into the ward and all that. Now, when I was grateful that God saved the life of my daughter, I went back home crying. And the reason is simple. I thought about Nigeria. Can this happen in Nigeria? Will this happen in Nigeria? Secondly, one of my friends, my very close friend, brought his wife to UK to give birth. The lady arrived, had the baby, and 2 days after, a health visitor went to the house to see her. And she was breastfeeding. When the health visitor got home, she realized one breast was bigger than the other and said, "What's happening?" And the lady said, "Oh, I have a lump in my left breast. Although it's been checked in Nigeria and they said it's okay." The woman said, "No, I'm not happy. Let's go to the hospital right now." They got to the hospital, my people. She was living with stage 3 breast cancer. And in Nigeria, she was told in a very big hospital in Lagos State, I'm not going to mention the name, that it was nothing. We lost the lady 9 months after to cancer. Now, the solution is simple. We can't keep politicians who don't respect life and healthcare. We can't keep them in power.
Ayo.
These people don't care about the lives of the masses.
Ayo, can you hear me?
Because they are able to travel. Yes.
Please, how affordable is healthcare in? I'm talking about the case of your child now. How affordable was that treatment that you got?
My sister, it was absolutely free. Absolutely free.
It's a child now.
I think they have health.
Absolutely free.
For children.
You know? So, you see, if we can't start with a place of policy.
You know, thank you very much, Ayo. You're right. I mean, and what your story reminded me of my own story, which I've shared on this table a few times. My little boy, at the time, when one of my twins, he was not breathing at night. I think I shared that story many years ago. I think it was like 4 years old, I think. And what happened, interestingly, 2 days before that thing happened, Akiade was just telling me that his daughter was sick, and he rushed her to one hospital down the street. I can't remember the name of the hospital. And that doctor was so nice. And I collected, said, "Please, that doctor is very nice. Please just give me his number, just in case, the pediatrician." My son went to, he was stopped breathing. He was sitting like I just woke up at night. He stopped breathing. And his hair just rolled down like this. I said, "What?" I woke Brown up. We rushed him. I called that doctor around past 2 a.m. This doctor called me. He picked up my call. He says, "Okay, bring him down." We rushed there in our pajamas. We got to the gate. The gate was locked. We carried the child. We walked through the passageway. Family was carrying this boy, running to the hospital. As we entered the door like this, exactly that man's experience, what we saw. The 2 nurses, a stretcher, oxygen, everything was awaiting us at the door. We pushed right at the reception. They resuscitated my son at the reception. The doctor was there waiting for us. Do you know that this doctor has gone to Canada? So this experience, this man saying that, can it happen in Nigeria? It could have happened in Nigeria because we had some of the best doctors. But this man has seen, and his hospital is locked shut.
So there's a reason I asked what the value of that treatment was. So we have policies like that here. And I will not go far. I will say because we want to use my experience. When I was in that mother and child hospital, I know how much I paid for my first delivery in a private hospital. The natural birth that resulted in a cervical situation for me cost me over 200,000. The same thing in the private government subsidized hospital was 25,000 at the time, 600 naira. And now, childcare, at the time was free. You see your pediatricians, and they are all there. They give you drugs. You go to the pharmacy. Once it's child drug, they'll tell you the ones that are available. Even to antibiotics, the one I used for my child at the time, and everything was given free. Come there after a while. Nigerian have happened. Who is Nigerian? We, the people.
We.
Yeah.
You now go to the pharmacy. I took my son to the same hospital, same pharmacy. All the drugs prescribed for the child was not available.
I say, it's because you people are too young. Nima, it's because you people are too young. When I was growing up, Lagos University Teaching Hospital, that you are seeing there, was one of the best hospitals in the world. I'm telling you for a fact. My mother was always on admission there. Look, when you enter that hospital, you will want to be a nurse. The nurses, man, you will see their... Well, if you are wearing purple, I think you are a student nurse or something. From head to toe. They had the purple uniforms, they had the blue uniforms, they had the white. The white were the matrons or something, or staff nurse. Then you had the blue, that was the all blue, that was the matron. Look, the wards. When my mother was admitted, we used to go and visit her. All of us wanted to be admitted. The food, when they bring the food, go there now. Go there and see. Nigeria has happened, like you said. I'm telling you, and what is paining me is that we have a population of younger people. So many people have not experienced or did not experience what we experienced.
So they think it's a foreign thing.
Let me take this call from Adebayo. Good morning, Adebayo. Are you there?
Yeah, I am there. Good morning.
You're live. Go ahead, please. Can you hear me?
Yeah, I would like to contribute to the program.
Please go ahead. It's your view.
My wife is a consultant, pediatrician, and she works with India.
I can't hear you.
Hello, good morning. Can you hear me now?
Yes.
I can hear you.
Okay, go ahead,
please. Please go ahead.
Okay. So I would like to contribute to the program. My wife is a consultant pediatrician, and she works in Nigeria here. Hello?
Yes, go ahead.
Okay. You see, the problem with the medical sector in Nigeria is that we are not properly funding, and we've not even agreed on how do we fund this healthcare. The last caller talked about the UK. In the UK, they have a health insurance scheme that everybody contributes to. So with that, we're able to catch everybody along. In Nigeria, the same thing has to apply. There was a time here on the program that you talked about the hospital that they are building at Aso Rock. And they said that the total amount they're using as in the capital project, you don't even have it in other hospitals. I went to go and check the budget. Look at UCH. I am very conversant with the budget. The federal government is going to spend 22 billion to pay salaries for UCH staff. But they are going to invest 1.something billion in the infrastructure there. How do you cope with people? So as Nigerians, we need to sit down and agree on something. Imagine if all of us contribute like 2,000 naira every month to this healthcare program. We will be able to take care of everything. Imagine even look
Thank you very much, Adebayo. I know that, you see, we try to have the NHS in this country. First of all, there are two sides of it. Nigerians sometimes will not pay. Some would pay. Others who don't trust the system and just choose not to pay. Now, when they now finally pay, some will still not ensure the doctors get money. Because I remember this doctor that I said that they relocated. One of his greatest frustration is that when he wanted to, he doesn't get the insurance money from the insurance companies, especially when they go from federal government. They don't remit back to the doctors.
When they started the NHIS, they had some HMOs that, were receiving money. Their business is to pay the hospitals. You have already deducted from source, from your salary, they're taking their money. They're now having issues paying these institutions. NHIS, on the other part, deducts from civil servants, and then paying facilities that have subscribed to the NHIS in Nigeria was an issue. They investigated it in this country. They suspended somebody. And while the person was being investigated, he was suspended and reinstated, and the investigation was still ongoing. No justice. So every institution in the world has the tendency to be abused.
Absolutely.
It is regulation and consequences of action.
And sincerity.
That ensures that somebody must even do sincerity. So anybody there is human. Anybody can fail. These abuses can happen. When you deduct money from source, am I the one not paying? But somebody then siphons the money, uses it for anything, and then the person goes back and becomes a senator in this country. Nothing happens.
It's just like this one that the Ministry of Human Affairs or what they say
Humanitarian affairs. 20 billion.
Please, I mean, where are the figures? Where is the
Let me go on a break. Let me go on a break. Hold that thought. When I come back, continue the conversation. Stay with us.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we're still discussing this issue of our medical situation. Listen, there's a part of the government, and I think, as usual, I like to not even pack the government issue because it's like it's in your face. It's right there. Don't state the obvious. But what role can we, I'm a business owner. I own a hospital. What can I do? Because one of the frustrations of this, my doctor that I talked about earlier, I can't even remember his name. That, number one, he was trying to be a good guy. When people come to the hospital and they can't afford it, he gives them for free. In fact, was like a pastor.
There was one that was on our show
for free. And then he wasn't, the NHS wasn't paying him money. So he was just letting people just go for free in that kind of situation. So how does he run a business?
So that's why I at first had a feeling for this hospital, because this hospital probably had cases where family members would abandon a dead body because they don't want to pay the bill. And they will run away. So the only leverage they had was the child struggling to breathe.
Yeah.
Yes. So they were using the only leverage they had. It's like Nigeria had made you lost your humanity. Nigeria had made them lost their feelings. So you're behaving inhuman because of what Nigeria has taught you over time. But what helps is for us to have a strong system. We had a young man that came from the UK that was talking about the importance of checks and balance and how the UK has very stiff registration system that recertifies you over and over again, and that he is now trying to work with state governors to create that same structure within different states to regulate private hospitals as well as the public hospitals, creating a system of check. Every doctor must do some recertification over and over again. That is on one side. On the other side is the fact that Nigerians have gotten away with doing nothing. Like, we've gotten away with... We've gotten away with the fact that nothing will happen. You know the statement, I will shoot you, nothing will happen. They will die, nothing will happen. You will go to court the next 5 years, they've not even given you court dates. So that nothing would happen situation at the detriment of people's lives being lost is part of our major problem. And we need to become more caring.
Let me take this call from Abimbola. Good morning, Abimbola. Are you there?
Good morning, Morayo.
You're live. Go ahead, please.
I just want to quickly say something. The topic you are discussing this morning was a story I read yesterday in The Punch. And it was so pathetic that a child died. In fact, the mother died, and the child was about to die as well. That is the situation in Nigeria. Human being or human life means nothing to anybody. When Lady Sister Nima asked, I think second caller, what was the cost when the daughter was taken to the hospital? What I want to add to that is, in England here, health service is free for everybody.
Citizens.
Well, yeah, whether you are a citizen or not, if you live here and you live here legally, health service is free.
Yes,
okay. And if you have a condition that will not for the rest of your life, you get medication free for life.
Wow. But let me pause you for a second. You see, when we say these kind of things, let me pause you for a second. It's easy to say that, oh, it's free once you live there legally. That's good. But it's not free because you still pay taxes. Yeah. And all of you pay taxes. And not even small taxes that we're even begging Nigerians to pay here. Points. What are we begging them to pay? You pay like, I don't know what the percentage is, but there are some states in America that is way higher. So our own people, we the Nigerians, we will choose not to pay taxes.
Here.
Many of us don't. Yes, those of you that do 9 to 5, we pay because we have no choice. But in many of the informal sectors, some are paying levies, but none of this money is not coming into the coffers of the government. So Nigerians don't even have the capacity. Even rich men who are doing businesses are not paying taxes. So we have a lot of Nigerians who are part of the problem. So a man is telling me that it's free for him in the UK. Yes, it's free. Because that money the taxes, and they're using to pay those medical bills. Somebody's paying.
Can I just say something?
Yes, please.
Can I just say something? Can you remember when Richard Branson brought Virgin Nigeria, Virgin something, Atlantic to Nigeria? And then he left. After a few months, he just packed his bag and left. And he made a statement that I read. I'm sure I've shared it with everybody.
Yes.
He said, it is the government's... Listen, he said it's the government that they are... Nigerians are generally nice people. And it's the government that all the kiniko. Then he now said, but who is the government?
Nigerians.
Nigerians. So he said, luggage area, to the person packing the plane, everybody. So you see, let me tell you, what Nigeria is today is reflection,
all of us,
of the government. Is the government reflecting?
Yes,
on all of us. So government, we cannot absorb government. Let me finish. We cannot absorb government because we are students.
No,
we are there.
No, we are there.
No, we're not look, tomorrow. Excuse me. Listen, Murayo, you go into government tomorrow. Within 1 year, you will be like them because look. We are reflecting ourselves. Government and Nigerian citizens, we are like mirror.
Okay, fine, YK. So
we are seeing ourselves.
Let's have a conversation. I hear you, YK.
Ourselves.
I hear you. Let's have a conversation. If the government come out today, okay, guys, we are 250 million Nigerians. All right. So let's just say 50% of you can actually pay taxes. They are trying. The revenue used to be from the oil. They now said they want to now do generate taxes from taxes. Many Nigerians have refused to pay tax. Not even the regular ones are paying, but those businesses, especially many are not paying taxes.
The parties of government don't pay.
The MDAs are not even paying their electricity bill. The parties of government are also not paying. So the truth is that we are our own enemies because if we actually even if we now decide to pay tomorrow. The people are still cynical and saying that they will not use the money efficiently. So it's both sides.
Why would they be cynical? If you are government, you are influence. If Buhari says, I am president today, even though I have my medical history in the UK, please move my medical history to a facility in Nigeria. I'm not even saying it should be a public one. Don't let it be Asorok. Just find one privately well-funded hospital here in VI or somewhere that is secludedly for you alone. Yeah. I'm telling you, every Nigerian will sit up. You are influenced. You can make, but you can insist that from today, any visitor coming to the country in Asorok will be fed amala, elubo, tuwo, Nigerian food only. Because I eat it. We want to promote Nigeria, and we see it at every event. It will become national global. We will now be able to monetize and export.
Stop bringing in the bacons and the sushi.
But when you people say it in the paper, we tighten our belt from now on. Nigeria is broke. And we are owing China this amount of money, X amount of money. But tomorrow your daughter's wedding comes up, and it is big town. No, we cannot. iPhone X, and one was the one that has to be. He's the president's daughter. It has to be branded. Hey, John Tori, who are you deceiving? And Nigeria that cannot afford that money will say now, Shebi now, is that president that used Nigeria money? It's my own money I'm using.
Exactly. So that person will not pay tax. That person will not pay tax.
You cannot give your party waivers when they are bringing in the consignment into the country.
The question is, who's going to break the cycle? We need a leader. A leader that has to break the cycle.
2023 is coming. We need that leadership, and we need to open our eyes to the opportunities. And that's why I said that we cannot. It's like insanity is doing the same thing over and over again and expecting a different result. So when you look towards the current structure of the way things are going, and you're now thinking suddenly this same system, this same circle will produce a different result for us. It's not going to work. Exactly. We will have to do what is uncomfortable. We will have to go against the norm to achieve the goals we want. Whether in health sector, whether in... I was coming back from the country and I had boxes. And I was walking to the immigration. The person that was pushing my card said, they will check your boxes. So are you ready? I said, don't worry, I'm not bribing anybody. They should check. I got to do this. They say, open the box. I opened the box. They said, I said, you can check everything. And I saw people that were with bigger boxes go past. They did not go past because they had a nice face. They went past because something has been sorted. So they went past and I was opening my boxes for them because I knew that you think that I want to waste my time?
This is what I'm saying. Because somebody actually came on TV yesterday and was saying the aviation system has checked it. Let me tell you, when you go abroad, nobody is checking your box. And it's not because they are not checking your box. They are checking your box. Your box comes out. They scan your box. It is when you have illegal things that they will stop you. But here, they are not using scanner. They will just open your box. Look at your face like this.
No, you don't have $1,000.
Then they want to disgrace you. They will bring out your pants like this. That's all African nations. It's not just Nigeria. All African nations. We are just backward. And it's because we are just reflecting ourselves. The leadership is the people. The people is the leadership.
Consequence.
So we need a break in this
I need to take this tweet. First, Akimboyewa says, the true story of our healthcare is that there is no money to fund the sector. It is good that our doctors are migrating to the UK, but do they know that they pay through our nurses to fund the NHS? He lives in the UK. This year alone, we will pay an average of £2,400 more in taxes, saying that, you know, these monies are taken through taxes. I have lived in the UK for 30 years, and I can say that while the NHS treatment is free at the point of delivery, NHS is centrally funded, is a centrally funded system through our taxes. We enjoyed good and free healthcare in Nigeria when our population was under 50 million, but it's no longer sustainable.
Exactly. And I wanted to say something about taxes. You see all these people paying taxes in the UK. When they reach 60,
they don't have to pay again and they still enjoy.
They enjoy what they paid. Government now pays them back. Because government will give you
the system works.
Retirement, benefits, all that. You go enter bus free.
Even abroad, you can file tax returns every year. So,
you see, these are the things. Because if you tell me I should pay tax, and then I'm asking, what am I getting in return?
These returns we're talking about didn't happen immediately. This country started asking for taxes. It happened years after. So, first of all, let's even gather the taxes first. Let's see how much money has come in. Let's see what we can do. Whatever is the excess, let's start filing returns so I can give you a rebate. You see, these things will happen to come naturally, but first, pay.
Excuse me. You see, government. Let me help you.
First,
government workers. They pay whether they like it or not. As they are getting their salary, their tax has been removed from source. Now, excuse me. When they are finished paying and then they retire, except maybe the big ones like PAMSEC, level 18. The small ones, you will see them on the road. You see them on the road crying. Please pay my tax, my pension. Police.
He will queue.
Police.
They pay their taxes.
They will be looking for, they will be begging. Then when they even pay, after 1 year, the money is finished. It's supposed to be a steady thing. They will start begging. And there is one policeman that keeps begging me for money.
All right, let's take a few
messages
on YouTube.
Okay, I am Stretchy says, God bless you. I want to say that the issues did not start today. That's Joshua Ugumadu. He says, what you see is what you get. If doctors can go on strike, government won't do anything. Then what are we talking about? Facilities. Incompetent leadership brought us this far.
Bilikis Morenike says, this anti-Yanis blast from the past brought me to tears. We never got the experience of that youth. The youth we met was in comatose then. Truly disheartening. Now, this is what I'm saying. This is what I'm saying.
So we need a leader who is going to take us from this, who's going to break this cycle. Because I said, everybody has a part in this. Not just the hospitals, not the business owners, the people, the government, and even
So something happened. Why? I think I was very small when I was not even born when Buhari was in power. The first time that then it was General Muhammadu Buhari was in power with Idiagbo. But I heard so much about war against indiscipline. I heard so much about Nigerians queuing up everywhere. I heard so much about how things were already bad, for not as bad as this, but he was able to bring order back into the country. And that was why when the president campaigned the first time, I felt, oh, this man, this disciplinarian, this man that was able to bring order into Nigeria.
Remember, Buhari was complaining that during his military was different, too.
Yes,
that he now had to follow the due process because of democracy.
Yes.
He was already lamenting.
Even in the due process, the planes, you know, when our politicians are going to travel abroad, they don't follow queue. They just go above. Yes. When they are going to drive on the road, if there's traffic, they do they go past. So, like, there is no orderliness anywhere. We had
everybody just wants to be a big man
in Lagos
who
said he will stay in the queue. That is leadership.
Yes, that is leadership. That's the influence you're talking about. That's
being reflection. A different system in the entire state. Suddenly, Lagos became orderly. There was no everywhere. He had passed my side before. The deputy governor Adebule at that time drove past me. There was no noise. They stayed in traffic. I was like, is this Lagos? Is this Nigeria? Guess what? Leadership changed. We went back to the status quo. That is power of leadership. One person can cause a pivotal change in this country if they are willing to
sacrifice.
Okay, let me take this call and I'll come to you in YK. Good morning. I think I have Peter. Peter, are you there? Someone who doesn't use siren now. Yes, you're live. Go ahead, please.
Interesting.
Yes. Good morning, everybody.
Good morning.
Yes. I'm a first caller.
Welcome to the show.
Yes. I just want to speak in line with what YK said. You see, this country used to be good. It is because we brought ourselves in this way. Now, I want to speak in line with YK. YK said that loot used to be very good. Yes, I agreed with her. Not only loot, even when Leke Twiton, the then Commissioner for Head of Lawsuit, Ikeja. I remember I took my wife there, and do you know they did an operation free for her? That was when Nigeria was good. We don't know how we'll find ourselves in this mess that we are today. I want to beg Morayo, please don't support the government so that they can do good things. Don't support the government, because if we continue to drum this thing for them, they will continue in their mess. They will never change. Somebody was talking about in England where they don't pay fees, and you are talking about people they don't taxes. You are talking about taxes.
Thank you, Peter. Thank you, Peter. You see, there's always this us and them thing Nigerians like to do. We like to stay on this side and abuse the government. It's all of them, government. It's such a comfortable and convenient position to be. We do it a lot. And we're so used to it. It's not the norm. Even those abroad, they like it. They enjoy that negative energy. How was going on? Hey, they're suffering. Oh, my goodness, it's terrible, terrible. It's a good gisting topic. That whole I went to that, God saved me. I rushed into the airport. I came back to America. I came back to London. But the truth is, some of us live here. And some of us must choose to hear the government. So I'm not saying I must support the government. I'm not trying to support the government. I don't work for government. But I'm trying to understand where they are per time. I must try to understand their own side of the story. Half the time, they are obviously not doing what we don't want them to do. But somebody must at least listen to them. And that's where I come in as a moderator.
Why this happens, there's a problem why this happens. There's this wide, unaccommodating gap between the people and government. And it's sad. And so people on this side, we keep saying those people on that side. Yeah. If government was approachable, that gap for us. Every government must bridge that gap. Every government must be reachable. Every government must be like for BRF that could take a phone call that bridge the country, and he would direct the ministry under him to do the right thing. Every government must have that close reach, and they must be also able to take criticism. You don't have to sack an imam for telling you that people just died on Kaduna, Abuja train attack. Oh,
that was so horrible.
You don't have to. That is the truth. It's obvious. It's everywhere. And so because people would see that they cannot talk to you, and you're coming, that you want to near president in public, it is always them against us.
Right.
That's why. That was one of the reasons why Obama was so popular. Because people could reach him, people could talk to him. But I was just going to say about what Tokwe said about, you know that police, when they are doing their siren, they go on one way.
Yes,
you, because you are carrying one dignitary. How? You are the one supposed to correct us now. Why are you on the wrong side of the road?
When your Okada does it, carry siren.
Because, you see, when Okadas do it, I am angry. And I just wish I had power because I would not get a van. A big, this big truck. As they are driving that one way, they will be driving inside my truck.
Okay, there was a time, many years ago when I was driving in Lagos, I went to go and put Koboko. Like in front of my car. Thinking like I can be one day I will foolishly remove the Koboko to go and slap one Okada ride bus. He comes to hit my car. The guy held the Koboko, pulled me, almost pulled me out of the window. Myself, and he pulled me and the Koboko outside the window. I pressed my brakes. But you see, that's self-help.
No, Nigeria was doing that to you. Yes. Nigeria was turning you to help yourself.
Yes.
And it's a struggle to not let Nigeria do you into itself. So because we look at people and we begin to mirror their activities until we remind ourselves this is not who I am. So I need to remind myself I'm not like this. So
let me take this call, and I'll come back to you.
I must be above this.
No, sir, are you there? He's been holding for a while. No, sir, are you there? I do apologize. Go ahead, please. You're live.
Okay. Good morning, madam.
Good morning.
I'm following what you are saying, and it has a lot to do with us as Nigerians,
Exactly.
Madam Morayo is talking about tax on the side of the government. Practically, I stayed outside the country, Europe, and I stay in Singapore. Now, these countries, they live on tax, and the citizens see what they do with tax. In our own case, we are busy paying. We are not seeing what is going on with the money. So how will you encourage a normal citizen to put his money in an ATM that doesn't have return? Okay, I'll give you another example. Practically all Nigerians are being taxed. If I transfer 10,000 to your account now, the bank takes 50 or 100 naira from the money. Where does the money go to? Give us another evidence, then if everybody will be interested, and all of us will pay our tax normally. But all we have paid over the year, our father paid, grandfather paid, there's no headway. So how will people talk about tax when there's no evidence?
Thank you very much. I mean, that's a very valid.
In fact, that's
It's the cocoa of the matter. That is the real
Chopper said
cocoa.
something down that is very key. If you become government, you can blow siren and do one way. All I want to do is become government. All I want to do is blow. That's how the materialism started.
Yes.
All I want to do is be a big man, be able to break walls and access people and have people, big men that I can phone call and abuse the system. And that's how the abuse just continue to permanent. Everybody that knows somebody continue to abuse the system. If you know somebody that you cut corners, you don't get a full tax, or you get waivers, you do. That's what this whole thing is about. Everybody's dream is make myself just reach there, and I can do the same.
So what are you saying?
If I don't reach there, make I blow in one way or the other.
Yes.
Even if it's by 419 or Yahoo.
We have to wrap up because we're going to bring in somebody who might be one of our solutions to these problems. Yes, Tokwe, your final comment.
Yeah, my final comment would be that we must always check ourselves, because subconsciously we begin to behave like the government we dislike. You know, they say a woman marries the father they don't like, or a man marries the mother they don't like. I don't want to be like this person. I don't want to be like my mother, you become your mother. I don't want to be like my father, you become your father. Because like you mirror what you see. As Nigerians, we don't like what we're seeing in leadership, but subconsciously we are mirroring it. Let us begin to tell ourselves the truth and stop mirroring what we don't like in government. Changing ourselves.
Even when we go abroad, some of us do exactly the same thing. In the various, I hear of complaints within the Nigerian community.
Yes,
what they do to each other.
The comedian, he was made to take driving lessons in the UK. He go and drive over speed. It's doable here. Nothing would have happened.
But over there, they show him.
That's all we can take on this segment. I mean, it's so sad again that woman had to die. It's so really painful. Many of us, I've been holding my own mother's medical experience story for some time. I'm waiting for the good day to talk about, not now, because it wasn't totally all smooth. You know, there were issues. So we all have these experiences of the medical in Nigeria, and it's a sad story. We have to wrap up now.
They just lost a friend last week, so and it could have been avoided. You know, it's terrible.
It's really painful. That's all we can take on this segment. When we come back, we'll talk to our female aspirant. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.